Hello, my name's Ramya Nissan, and this is a response to the video question that was requested. So, to answer the question, in clinical research, we often learn that probability sampling is the gold standard because it increases representativeness and strengthens the generability of the results of any kind of study. However, despite these advantages, convenience sampling continues to be one of the most widely used sampling methods in clinical and applied settings. One of the main reasons for this is that clinical environments rarely provide the time, the resources, or access necessary to randomly select participants from a broader population. Convenience sampling allows researchers to recruit individuals who are already available. So, for example, patients in a clinic, clients in a rehabilitation facility, or athletes in a training program. And this practicality makes it far more feasible than probability sampling for real-world studies. Moreover, there are several reasons why convenience sampling is also very common. First and foremost is the logistical constraints are the biggest factor. Convenience sampling allows clinicians to incorporate research into their existing workflows without disrupting patient care. Second, funding limitations often restrict the ability to conduct large-scale recruitment efforts. Random sampling methods frequently require additional personnel, technology, outreach resources, and for smaller clinics, outpatients, centers, and school-based health initiatives, these costs are simply not feasible or available. So sampling whoever is accessible becomes the most practical and realistic option. However, reliance on convenience sampling does not come with important implications. So one of the consequences is reduced generalizability of the studies, since the sample may not actually represent wider populations. Convenience sampling also creates threats or risk to external validity, limiting how confidently clinicians or researchers can apply the study findings to other populations, settings, or demographic groups. Despite these limitations, researchers can take several steps to minimize the drawbacks of convenience sampling. One of the strategies is to clearly define the target population and describe sample characteristics so readers can judge how representative the sample may be. Another way is to use consecutive sampling. So that's where every eligible patient who enters, or participant who enters a clinic during the study window is invited to participate, which helps reduce selection bias. Researchers can also increase diversity by recruiting from multiple sites, for example, from different physical therapy clinics or fitness centers, to capture a broader range of participants. Finally, transparency in the reporting and discussing the limitations also strengthens the credibility of the study, even when probability sampling is not feasible. Overall, convenience sampling persists in clinical research because it aligns better with real-world constraints. And while it cannot replace the rigors of probability sampling, thoughtful design and transparent reporting can help researchers obtain meaningful and applicable findings within the practical limits of the clinical environment. Thanks.